So again, I'm going to speak with you today about the lived experience of growing up with type 1 diabetes. And so you know, for anyone to hear the words, "you have diabetes," that is especially frustrating, scary. The patient often thinks, okay, what do I do with my life now? But those words are especially frightening to a young child who is diagnosed with type 1 diabetes. And so my experience has been with diabetic patients, and I worked in an endocrinology office. And I saw that when those who were diagnosed with type 1 diabetes as children, once they get into the adolescent years, this is a difficult time for them. And all of us here, having gone through the teenage years ourselves, you know that it's a hard time in life, the teenage years in general, and then you think about having to manage type 1 diabetes on top of that. It becomes frustrating, and that carries over even into young adulthood. So when I had the opportunity, when I was in my Doctorate of Nursing Practice program, to conduct a scholarly project or study, I wanted to look at what the lived experience was like for those who were diagnosed as children, to see what it was like growing up with type 1 diabetes. And according to the American Diabetes Association, the most recent statistics that I was able to find, that there are approximately 1.25 million American children and adults now living with type 1 diabetes. And during 2008 and 2009, during those years, there was on average more than 18,400 new cases of type 1 diabetes diagnosed. So that is a problem that we have ongoing here in our country and around the world, because in fact there was a study that was done in 2010 that found that on average there has been each year a 2.8% increase of the diagnosis of type 1 diabetes around the world. So managing type 1 diabetes, as I have already said, it does take a lot of work. You have to be careful to check the blood sugar, insulin dosages, and that sort of thing. And all of us here in this room, I'm sure, are aware of the complications that occur with uncontrolled diabetes, or when the blood sugar is allowed to run high. With excessive hyperglycemia, you know, the risks are increased for developing nephropathy, neuropathy, retinopathy, cardiovascular disease, increased risk of stroke, increased risk for amputations. Of course, over half the amputations that are done in America that are non-traumatic are because of uncontrolled blood sugars. So that's really frightening. So we want to be sure that these young people who are being diagnosed with type 1 at an early age get what they need to be able to control their blood sugars throughout the life and decrease the risk for developing these complications. And you know, I've already really talked about most of the information that's on this slide. It's a busy slide, but the important thing to know is, you know, there are those complications. And of course, too, with type 1, there's also the risk of developing low blood sugars. The risk is a little bit more than in type 2, and of course that can bring on serious complications as well. And also there are the short-term complications that come with elevated blood sugars, and that is the diabetic ketoacidosis that can, you know, land someone in the hospital and can also be life-threatening. So those are things that we want to help these children be able to manage. And a landmark study for diabetes, the Diabetes Control and Complications Trial that was conducted back in the 90s, did reveal how that strict control of the blood sugar can greatly reduce these risks for diabetes-related complications. And a study that was conducted by Sechrist, Becker, and Kelsey back in 2010 did learn that those who were diagnosed as children between 1975 and 1979 continue to have a mortality rate that is greater than 5 times greater than the general population. So we still have some work to do in helping these children who are diagnosed with diabetes. We still have some work to do to help them learn how to control their blood sugars so that they do not encounter these risks. So as I said, managing type 1 diabetes in adolescent years is particularly difficult because during that time the children are growing up, they are becoming more independent in many ways. And also at that time there becomes a need for the transition of care from the parent to the child. And so the children are not as compliant with their treatment. They report that they feel excited that they are having a little bit more freedom, but then they are also burdened by that responsibility of having to check their blood sugar, having to watch their diet, having to take their insulin as they should. So I saw that as a problem. I saw that these adolescents and young adults were out of control, and so I wanted to explore what their lives had been like as they were growing up to see if there is some way in childhood when they are diagnosed that we might be able to implement better education opportunities and more support for these children and for their families to help them have a better experience growing up and to help them have a better experience once they reach their young adult years. So what I wanted to do was elicit personal stories from these individuals through one-on-one interviews and also through pictures. So this is a photo elicitation study of the lived experiences of growing up with type 1, and I wanted to identify common thoughts and feelings, and like I said, just seek alternative ways that we can be supportive of these individuals. So my project was really small. I used a convenient sample from the clinic where I was working. It's a small clinic in Kingsport, Tennessee, and we were only able to have 5 individuals who actually agreed to participate and did follow through with the study. I had some others that agreed to participate, but then they did not follow through. But they were all diagnosed before the age of 13, and so we explained the project. They signed consent, and they actually signed consent to allow me to use non-identifying photographs that they submitted. So after we explained the project to them, they were given 2 to 4 weeks to go out into the community wherever they wanted to go and take pictures of things that reminded them of what growing up with type 1 diabetes, how that felt to them. So they submitted their pictures, we had the one-on-one interviews, and then we discussed the relevance of the pictures that they submitted. And what I was able to find from talking with these individuals and from their pictures, which I'm going to share some of their pictures with you in just a few minutes. But of course, as anyone would imagine, this was a life-changing experience for them. They felt that they had a lack of understanding from their school teachers, from their coaches. They felt different from their friends. Some of them reported that their friends didn't want to play with them anymore. They thought their diabetes might be contagious. They were afraid that they would get sick too. They were embarrassed. They didn't want anyone to know that they had diabetes. They found that there was no plan or structure for them during the transition. So that it was really hard, that transition period during the teenage years. There was no structured pathway for how the parents should let go and give the children an opportunity to control their diabetes. And they felt like the education that was provided when they were diagnosed was more negative rather than positive. They felt it focused on the negative. And they felt like that the diabetes education really told them what to do, but not how to do it, not how to live with it day to day. So these are some of the pictures that were shared with me. This one was from a female participant, and her mother actually took her out of school once she was diagnosed to homeschool her so that she could be there and help her manage her blood sugar. So every day after they had lunch, they would go for a walk down the road to help bring down her blood sugar. And so this picture of the road reminded her of her time growing up with type 1 diabetes. This picture of a gymnasium, this was from a male participant. And when he was in elementary school, when his blood sugar would go high, the teacher would send him to the gymnasium and have him walk and walk and walk around the gymnasium to help to lower his blood sugar. And he felt very self-conscious about that because there would be older students in the gymnasium who were having their gym class, and they were dressed out for gym, and he was in his street clothes, and he had to go in and walk around the gym. And this was really embarrassing for him and really made it hard for him to have to, function in school that way. And this photograph is from the same participant. He said the doctor told him right off the bat, you can never drive a big truck or you can never fly a plane. And he said that was just devastating to him. He just felt like that, what was he going to be able to do with life? Little boys, they want to do things like that. They want to drive trucks or be firemen or fly planes or things like that. So that was really hard for him to get a grasp that at such a young age that he was never going to be able to do these things. And in turn, they didn't tell him anything positive that he would be able to do. One of the participants had to go to the prom from her hospital room. She, unfortunately, because her diabetes was uncontrolled and she was having problems with high blood sugars, she went into DKA the day before her prom. By the time the night of the prom, she was stable enough that the doctors did let her go out for a couple hours, so her mother helped her to get ready. And you can see in the picture she has on long gloves, and they left the IVs in, or the needles in, the INTs, and she concealed that with the long gloves. And she was able to go for a couple of hours. Her parents stayed right outside the school waiting, and then they picked her up and took her back to the hospital. Another one talked about having to be on such a time schedule. I always had to be aware of the time, so they would know when to check the blood sugar, when to give the insulin, and just felt like that they were constrained and by the clock. And this one submitted a picture of an emergency room because she had to be admitted to the hospital multiple times during a 6-month period. And she was going out with her friends and not wearing her insulin pump. She would take her pump off because she did not want to feel different from her friends. And so then she would end up in DKA and end up in the hospital. The last photo I have here, you can't really read it, but it's from a journal from one of the females. And this was a journal when she was in elementary school. Every Friday her teacher had her write in a journal. And at the bottom, the very last line says, "My diabetes has no cure." So you can see that even as children, even at a young age, these children, they realized that this was something that they were going to have to manage for the rest of their life. And I can only imagine how devastating that would be to them and to their parents. So what the implication is for nursing practice is, of course, this was a small study and there is further research needed in this area. But I do think that we need to look at developing innovative ways that we can continue to support and educate the children and their families as they struggle to manage diabetes. And I have also already gotten some good ideas this morning from Dr. Flaherty, and thinking about how that we could probably implement Gene Watson's thoughts into taking care of these patients, because we want to look at them as individuals and not as diabetics, but as people. And also maybe we could look to the technology and explore ways that we could develop apps for education, or ways that we can stay in touch with these children and their families going forward. So I believe there's lots of opportunity out there for us as nurses to be able to make a positive impact on this population of individuals. And we need to focus on developing educational programs for school faculty and school staff, because I don't think there's really a good understanding there too as to how they can help these students manage and better fit in with the other students so that they don't feel like they're isolated. And also maybe develop some sort of educational programs for students if they have. I know now, we're seeing it more and more in the schools, and if we had a way, if there is a student or more than one student in a school that has type 1 diabetes, if there was some kind of child level education that we could provide to all the children so that they don't feel like that these children are different or that they're contagious, that if they play with them they're going to catch their diabetes and that sort of thing. So these are the references that I used. Does anyone have any questions? And these are my two grandsons. I just wanted to include them there on the end because I'm hopeful that they don't ever get the diagnosis of type 1, but if they do, I hope we have some ways that we can take care of them in a good way. Thank you so much.